Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Cardiovascular monitoring. Cardiovascular monitoring includes the following. In cardiovascular system monitoring, we will have to see the pulse rate, blood pressure, electrocardiogram and CVP, which is central venous pressure, and pulmonary artery catheterization and echocardiography should be seen on cardiovascular monitoring. So first, pulse rate. In the pulse rate we do pulse oximeter. Pulse rate is found out by pulse oximeter. Second, blood pressure. Blood pressure is of two types. One, we have non-invasive blood pressure. Second, we have invasive blood pressure. Non-invasive blood pressure. In non-invasive blood pressure is must be recorded every 5 minutes. In non-invasive blood pressure, oscillometric principle means that is, in oscillometric principle, mean arterial pressure is seen in non-invasive blood pressure. Then second, we have invasive blood pressure. In invasive blood pressure is a continuous recording of blood pressure, and invasive blood pressure is the gold standard method for blood pressure monitoring. In invasive blood pressure, the most commonly cannulated artery is radial artery. The patency of ulnar artery should be found out before cannulating any artery. This patency of ulnar artery is found out before cannulating the radial artery or ulnar artery, because this patency of ulnar artery is found out by the modified Allen's test. Color of when you obstruct or when you occlude the ulnar artery with your fingers, then the color of the occlude the ulnar artery, and then if you remove it, first you will have to occlude the both radial and ulnar arteries with your both the hands. Then then you should release the release the ulnar artery. Then once you release the ulnar artery, if the color of hand returns to normal in 6 to 10 seconds, then modified Allen's test is positive. If this does not return to normal in 10 seconds, then modified Allen's test is negative. If modified Allen's test is negative, then radial artery cannulation is contraindicated. Then radial artery cannulation is contraindicated. If radial artery cannulation is contraindicated, alternative sites for continuous or invasive blood pressure monitoring are ulnar artery. For ulnar artery, we should do reverse Allen test. In reverse Allen test, we will occlude both radial and ulnar arteries with your fingers, and then you will release the radial artery. If radial artery is patent, then that is, if the color of the hand changes on releasing the radial artery, that means radial artery is patent, so Allen's test is positive, so you can do ulnar artery cannulation. But if a radial artery is not patent, that means if still after releasing the radial artery, if you see paleness in the hand, then that means reverse Allen's test is negative. So in such cases you cannot do ulnar artery cannulation. The other alternative sites include brachial artery, femoral artery, dorsalis pedis artery can be used. Cardiovascular system monitoring, ECG, is mandatory during anesthesia. In ECG during anesthesia, lead 2 is recorded for arrhythmias. Lead 2 is monitored for arrhythmias. lead V3 and V4 is mainly monitored for ischemias. In them, V4 is more commonly monitored than V3 for ischemias. Then second, we have central venous pressure. Central venous pressure is not adequate monitor for fluid therapy. Best site for assessing central venous pressure is right internal jugular vein. The most common complication for using a central venous pressure, that is the most common complication for uh, the most common complication for using the central venous pressure through internal jugular vein is acute complication is arterial puncture. Most common late complication is infection. So in cardiovascular monitoring, we have the following parameters. In cardiovascular system monitoring, we use pulse rate, blood pressure, electrocardiogram, CVP, central venous pressure, then pulmonary artery cannulation, and echocardiography is used. So first, pulse pressure. Pulse pressure is measured with the help of pulse oximeter. Blood pressure. Blood pressure can be non-invasive blood pressure and invasive blood pressure. Non-invasive blood pressure is measured every 5 minutes by oscillometric principle. By this we measure the mean arterial pressure, whereas invasive blood pressure is the most important and it is a gold standard method. In invasive blood pressure we continuously measure the blood pressure. For this we will have to cannulate the artery, and the most common artery to be cannulated is the radial artery. Before cannulating the radial artery, we should make sure that the ulnar artery is patent. This ulnar artery patency is by the modified Allen's test. So modified Allen's test is done. First, we will have to occlude both the arteries. After occluding both the arteries, if you remove the hand near the ulnar artery, that is in the medial side, then the blood flows through the ulnar artery into the uh, arch, that is palmar arch, and thus you will see paleness over the palm. If the paleness is seen within 6 to 8 seconds, then it is positive, that is modified Allen's test is positive. If you do not see any paleness, then that is negative, that means the ulnar artery is not patent, so you cannot cannulate radial artery, because if you cannulate radial artery while ulnar artery being uh, blocked, then the blood supply to the palm is lost. So as a result, cannulation of radial artery is contraindicated if modified Allen's test is negative. Then what are the other sites other than the ulnar artery where you can do invasive blood pressure monitoring? Invasive blood pressure monitoring can be done on ulnar artery. But before we do ulnar artery, we have to do reverse Allen's test. Reverse Allen's test is similar to Allen's test, where you occlude both radial and ulnar artery with both of your hands. But now you will remove the hand near the radial artery and see whether the radial artery is patent or not. So if radial artery is patent, that is if you see the redness in the palms, then you can say that the reverse Allen's test is positive and you can cannulate the ulnar artery. If it is negative, then you cannot do ulnar artery cannulation. The other sites where uh, intravenous or invasive blood pressure monitoring is done is brachial artery, femoral artery, and dorsalis pedis artery. Then ECG. In the ECG, we do lead 2. Lead 2 is mainly important for the arrhythmias. Measuring of lead 3 and lead 4 is important for ischemia. Monitoring of lead 4 is most important for ischemia than V3. Monitoring of V4 is more important for ischemia than V3. Then central venous pressure. Central venous pressure, it is the best central venous pressure monitoring is done through right internal jugular vein. The most common complication of using internal jugular vein for central venous pressure monitoring is mainly acutely. Sometimes we can puncture the artery instead of internal jugular vein. So arterial puncture is the most common acute complication, whereas late complication is infection.
Thank you and thank you for watching.